Most people heard about HIV before, but have you heard about pre-exposure prophylaxis and post-exposure prophylaxis for HIV? Before I get into more detail on these topics, I would like to mention some basics on HIV. HIV, also known as human immunodeficiency virus, is a virus that can be transmitted through bodily fluids. The most common way of transmission is through unprotected sexual intercourse, especially in cases of men having sex with men. Another common way is by sharing syringes or needles with someone who is infected. Other ways of transmission may be during pregnancy or through breastfeeding. Once the virus enters the body, it attacks a type of cells in your immune system, leading to a suppressed immune system, which can eventually result in AIDS, also known as acquired immunodeficiency syndrome, where you are at a high risk of developing infections more easily that can be severe as compared to a person who has an intact immune system. What are some measures we can practice to protect ourselves from getting infected? The first one is using condoms when having sexual intercourse, which may also protect you from other sexually transmitted diseases such as syphilis. The second one is by being careful when manipulating or avoiding sharing needles or syringes that may be infected. And finally, by using pre-exposure prophylaxis, also known as PrEP. Now let's talk about PrEP. People who are HIV negative may benefit from PrEP to prevent getting infected if they are at high risk, meaning those who have a partner that is HIV positive, those who have multiple sexual partners, those who have unprotected sexual intercourse, those who have another sexually transmitted disease, or those who may share needles or syringes that may be contaminated. PrEP is a medication that is the combination of 2 antiretroviral drugs against HIV in one pill, and that should only be taken once a day. This medication prevents the virus from effectively entering our immune system cells and establishing the infection. It has been shown that taking PrEP may reduce up to 99% of the risk of getting infected through sexual intercourse and up to 74% when exposed to contaminated syringes or needles. If you think you may benefit from taking PrEP, I encourage you to discuss this with your healthcare provider so that you can receive treatment and protect yourself. Now I would like to discuss what happens if you are exposed to HIV and are not taking PrEP. In this case, post-exposure prophylaxis, also known as PEP, is indicated. PEP is a combination of antiretroviral drugs against HIV that should be taken every day for a period of 28 days. It is very important for you to seek a healthcare provider as soon as possible, preferably in a time frame of 72 hours or 3 days after exposure. Finally, I would like to highlight that both PrEP and PEP are most effective when taken as prescribed, and that effectiveness may decrease if not taken as indicated by your healthcare provider. It is also important for you to take note that these medications should only be taken by the person who they are prescribed to. If you or your partner think may benefit from any of these measures, do not hesitate and contact your healthcare provider for more information about this.